friends, thanks for tuning in today. I appreciate you so much, and I just want to share today the 4 most common ways that you can get your pain gone compared to the number 1 way where you can get the longest lasting relief. My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy and a chronic pain specialist, and I just want to share the 4 most common ways to get pain gone that people do in the traditional healthcare model that we have today. Number 1 is medication. If you're having pain and you go to the doctor, more than likely you're going to get some type of medication, whether it's a pain medication, whether it's an anti-inflammatory, whatever one they choose, you're probably going to start with medication. Number 2, if the medication doesn't work, the next likely step is an injection that is localized to the area. So what's the difference between the medication versus the injection? The medication you're taking systemically, meaning you're taking it via mouth and it's going to your whole body, but it's not necessarily targeting the exact area that you're having a problem with. That's what an injection is for. You get a localized injection. It may have pain medication in it. It may also have an anti-inflammatory. And you pretty much have a 50-50 chance of that working. Why is it a 50-50 chance? Well, if they give you an anti-inflammatory into the localized area and inflammation is not the cause of your pain, guess what? The pain does not go away. You might get a temporary benefit, but in a couple of hours you really don't feel much, or over the course of the next 7 to 10 days, your pain comes back. Now, what happens when that happens? Well, you get an injection and they're like, it didn't work. Well, let's do a second injection to a little bit different area and see if that works. And let's just say inflammation is still not the root cause of your problem. The second injection doesn't work. So now you've tried oral medication that you took through your mouth and you tried 2 injections. What's the next step? Well, it could be surgery. That's a possibility. Sometimes, exploratory surgery, see what's going on. That may or may not be the case. They don't tend to like to do that. But they might be looking at diagnostic tests if they haven't done that already. So now you're looking at x-rays, MRI, CAT scan, CAT scan, CT scan, any of those type of things. You might have a nerve test, if you're having some numbness and tingling. And those tests are going to say, I think surgery is indicated, or no, surgery is not indicated. If surgery is indicated, then you go and you do that. If surgery is not indicated, then you might go on to a pain management specialist. Let's just say surgery is indicated. You get surgery, and 4 to 6 weeks later, which is kind of the typical healing time, maybe it's 8 weeks, maybe it's 12 weeks, depending on the severity of the type of surgery that you had done. And what happens if the pain is still there? Well, here's the reason why that happens is because sometimes people have a herniated disc, which they get surgery for to either fix the herniation or to have a discectomy or to have a fusion. And that wasn't really the root cause of the problem either. Because guess what? You can have 100 people in a room and they all have herniated discs, but 50% of them don't have symptoms because the disc that's herniated isn't actually causing any pain with them. They're not having a problem with it. They didn't even know they had a herniated disc because they're not having problems. So my point there is that sometimes people have surgery for the thing that actually isn't causing the problem or the pain that they're experiencing. And I've seen this time and time again in my office. When I practiced traditional physical therapy, it was actually not uncommon for me to see people who had had previous surgery and their pain maybe subsided a little bit, but it returned. And they didn't understand why they had this big surgery and they still had pain. The reason was the surgery fixed a real problem. It definitely fixed a problem, but it didn't fix their problem for the root cause of their pain. So first of all, I want to be clear that some surgery is absolutely necessary. I'm not dismissing that as an option. I'm just explaining to you that people with chronic pain could have surgery where the surgery and the thing that was fixed actually isn't causing the pain that they're experiencing. So what happens then if you've had medication, you've had injection, and you've had surgery? Or those are the three options. Well, the fourth option is movement. And typically, it's movement by somebody else. So think of a chiropractor, think of a physical therapist, maybe even think of a massage therapist who's moving soft tissue. These are all things that can work and be effective, especially if surgery is not warranted. So what's wrong with having somebody else move you? Well, nothing's wrong with having somebody move you. They're there because they're the expert and they can help you. Those are the four common ways, and I'm not dismissing any of them as being effective. I'm just explaining to you that they may not be the real answer or the number one way to get long-lasting relief. So let's just recap. The four most common ways are medication, injections, surgery, if it's warranted, and movement, typically by somebody else. So what is the number one way where you can get the longest lasting relief? You. Now, you're like, well, I'm not a healthcare specialist. I'm not an expert. I totally get that. I'm not expecting that of you. But you can actually learn how to move yourself in pain-relieving positions and pain-relieving movements that actually abolish your pain faster than somebody else moving you. Here's an example. During COVID, I obviously wasn't open in my office because there's a pandemic going on. But I did telehealth, and I taught people how to move themselves so they could fix their problem. I took people from 70 out of 100 symptoms, where it's a high pain, down to 10. I took people who are at 90 out of 100 symptoms, down to 10 or 20, in 30 to 45 minutes. And so what they learned is that they had all these different body positions and movements that were out of alignment. So their right side of the body and their left side of the body weren't experiencing the same type of movement pattern. So for example, if they raised their arm on one side and then raised their arm on another and it was lower, and I'm mimicking what somebody might have done, I have full range of motion, but if they were able to do that but only could do this on this side, they had what we call an asymmetry. One side wasn't doing the same thing as the other. And then if they tried to move in a different way and they discovered they had another asymmetry. So what I learned, and because I already knew this, but because I had already been doing it in my office, but when I learned through telehealth is that if I could teach them how to scan their body, look at an upper body movement, look at a trunk movement, look at a lower body movement, they would discover how many things were out of symmetry, how many asymmetries they had. If we corrected those asymmetries through movement, they could fix themselves. Brilliant, right? Brilliant. And they could get relief in 30 to 45 minutes instead of having to go somewhere, which they couldn't at the time because a lot of places were closed, including some healthcare facilities. Some chiropractors were closed, some massage therapists were closed, some physical therapy offices were closed until they learned how to do telehealth. So fortunately, I've been doing telehealth with personal training clients since 2018, so it was a flawless and seamless transformation for me. But my patients at the time got lots of relief. And so what I'm sharing with you is that I've been doing this technique that I teach people since 2018. I'm one of 10 master clinicians in the country who is allowed to teach it from the founder who created the technique. And basically all it is scanning your body, learning what your asymmetries are, learning which movements correct those asymmetries, and decreasing your pain. Not only can you decrease your pain, but you can restore your motion, and you can move better, and you can do more things without having to even leave your home or your office if you decide to do the movements at your place of work. My point is, you can do 4 things that require someone else to help you, or you can do 1 thing that you can learn and fix yourself. Which option would you like? If you want more information, go ahead and private message me or comment me in the feed below. I'm here to help you. I'm here to coach you. And with the way healthcare prices are rising, with the way gas is rising, driving to and from appointments, it's super expensive to use the other 4 ways. Plus you have to wait to get relief because you're waiting for someone else. I want you to have relief today. Reach out to me. I look forward to hearing from you. I hope you find this helpful and inspiring because you can take control of your health. You can take control of your pain. You can move to reduce your own pain. Thanks a lot.